Hello, good afternoon, and welcome to this brief video on 5 ethical cases for you to contemplate, which we will discuss in class during this rotation. The first case concerns a final year medical student, Mariam, who was in a posting at Hospital Kuala Lumpur, based for 1 week at their busy accident and emergency department. The patient was admitted as an acute emergency to the resuscitation room. The doctor told her to insert an IV cannula in this patient. Though Mariam knew what it entailed, she had never actually performed this procedure beforehand. She didn't feel able to tell the doctor that she had never done this previously. In fact, she was very pleased and excited to be asked to do it, so she went ahead with the cannulation. Please reflect on this and think about how you would have acted in this situation. Was Mariam correct? She was certainly delighted to be asked to do this. It boosted her confidence, so she went ahead and did it. But was she correct in doing so? What alternative views of this do you have? And be prepared to discuss them in class. Let's look at a second case. This concerns a student who is a little younger, a 4th year medical student, who was delighted to be posted to the cardiology department of the largest teaching hospital in Malaysia, and especially pleased that he was attached to the head of department, who was both a well-known heart specialist and media figure on heart health issues. On his last day there, the specialist, during a coffee break, told Kamal that he had just come back from Europe, where he had been guest speaker at a series of meetings at the headquarters of AstraZeneca pharmaceutical company. As their coffee break ended, he handed Kamal an AstraZeneca branded notebook and pen. Take some time now to reflect on this and see what are the potential pitfalls here. What are the potential ethical and professionalism issues that may be at play here? Let's move on to case number 3. This concerns a group of final year students who are attending and posting in an outpatient clinic in a clinic kesehatan which is quite busy. Following the final teaching session, student David Lim asked the consultant to sign and chop his assessment sheet. The consultant saw that the box for cannulation on the list had been ticked, and he had specifically given instruction on the Monday of that week, this was now Friday, to tell the students that they were not allowed to do this during this posting. David then returned to the student group who were in another room and advised them not to tick the box for cannulation because the consultant will spot this and scold them. Another student, Anissa, was overheard to say, "Don't worry, la. Let the consultant sign the form. Just tick the box afterwards, la." So what are your thoughts about this? What sort of behavior is this? Is this ethical for a medical student or doctor to behave like that? A form was given to the consultant to sign, and then later on, having signed it, the form, in his absence, was altered. What does that amount to? What do you think if this was a prescription or it was a report of an investigation? Reflect on that until our class session where we'll discuss this case and the other cases in some detail. It was 7 a.m. in the intensive care unit of Hospital Kuala Lumpur as the new day shift arrived for the handover. Jenny, who was an enthusiastic final year medical student, was finishing her last day of a week's posting there. She had really enjoyed her week and had got to know the staff very well. Dr. Lee, whom she was particularly involved with, having shadowed him throughout the week, he was now the anaesthetist on duty and arrived for work and greeted her. She thought she could smell alcohol on his breath. He let out a yawn and said, Oh, I'm exhausted. I had a heavy night last night with my friends. We were in a club till 3 a.m. Imagine you were Jenny. What are your thoughts about Dr. Lee arriving for work, allegedly smelling of alcohol, and certainly giving the impression that he was out till quite late at night? Is he fit to take over the responsibility of anaesthetizing patients and to be working in the intensive care unit? And if not, how should this come to the notice of his superiors? Should Jenny tell on him? Should she advise him? She's a medical student. He's the anaesthetist on duty. What should she do? What would you do? Final case. Case 5 concerns the student who's now actually qualified, is now Dr. Anissa, and she's just completed her internship. And having finished her 2 years as an intern, she's now beginning her first medical officer post, and she's based at a clinic in rural Sabah. Yesterday she was consulted by Mariam, a married 15-year-old young woman who was concerned about her 2-month-old son Falik's feeding pattern. She felt he wasn't getting enough, and she was concerned that he was not gaining weight. After Anissa examined Falik, she was able to reassure Mariam that Falik was doing okay. He was gaining weight and he was well within the centile range that he should be in. As she was leaving the clinic, Mariam turned to ask the doctor to prescribe her the oral contraceptive pill, as she did not wish to become pregnant so soon after the birth of Falik. What are your thoughts around this case? What questions would you like to ask Mariam? What questions do you think Anissa should have asked her? And how would you deal with this request? Thank you.